We're there. We normally are when it says that.
Probably are. My phone is just always a second late to catch it. But anyways, welcome everyone. Welcome to another live with Holistic Vet Sisters. Today again we have Vicky Simon with us. Caroline has not showed up yet, so I guess it's the three of us today. Maybe Vicky wants to introduce herself again in case someone don't already know. She's been
I
here
mean,
quite a
yeah,
lot.
most of you already know me. I'm Vicky Simon. I'm a holistic vet in Somerset, and I do homeopathy, herbal medicine, acupuncture, and natural dietary advice.
And we're very pleased to have you.
It feels like I haven't been here for ages. I miss you guys.
It does feel like you haven't been here for ages, but you belong here, so it's always nice to have you back.
It
I'm
feels
just
like you
gonna
got such a nice tan, Vicky.
I mean, I went to North Wales, so ultimate sun location.
That's lovely. We actually do have a direct question here for Vicky, because Jane asked us on one of our posts, "Hey Vicky, I was wondering where your practice is, and if you were close, how could I be referred to you? I always prefer to use homeopathy for myself and my dog in the first instance, only going down the medical route when there is no other option."
So I am in a little town called Wiveliscombe in Somerset. It's very close to the Somerset-Devon border. So it's kind of halfway between Taunton and Tiverton, if you kind of roughly know the area.
And how can she be
Um,
referred to you?
so easiest thing to do is just to get in touch with me by email. My email is holisticvetvicky@gmail.com. But it's on my Facebook page, which I'm sure you can find through Holistic Vet Sisters. Um, and yeah, if you email me and let me know what the problem is, then if it needs an official referral, then I can send you referral forms, which you can pass on to your vet. If it's just that you want a health check or some advice or something like that, then we don't need to do an official referral. You can just come and see me and I can get a copy of the history if we need to or something.
Because you do online consults as well, don't you?
I do for some things. I haven't been taking on any remote consults recently because I've just been too busy with people in my catchment area. So occasionally I'll like have a quick chat with someone about nutrition or something that's easy to do remotely. Quite a lot about vaccines and what people want to do vaccination wise or not do.
Mm.
But yeah, most of the stuff I try and do in person, and I prioritize my people that can see me in person because
Mm.
I have limited time and I feel like that's the fairest option.
And there was also another question from Jane. Should we just go with that one straight away?
Yeah, let's.
So it was a bit of a longer question, but she's asking, I took my wire fox terrier to the vets recently and he was limping, wanted to check that there was no injury. I had given arnica as soon as I saw her limping. The vet cut her nails. One of them started bleeding, but no injuries otherwise. But they commented that it was probably early arthritis. I've had to empty my bookshelf so I can't see what Lisa Hansen wrote in her book. Everybody, Lisa has a very nice book on cat and dog health, which is my dog.
Always within reach.
Yeah, perfect. Which is my dog Bible around this.
Oh.
The vet wanted to prescribe pain relief. I said I wanted to try a homeopathic route first. She did suggest you move for joint pain. I home cook for puppy. We were not successful with raw. She's 12 and a half now, and she only appears to limp on certain surfaces, I've noticed. Often when she has chosen to sleep directly on the laminate floor rather than on her bed. She's fine going upstairs and okay with carpeted floors. Any advice would be greatly appreciated.
If I can, if I can start with
Hmm.
that one, I would say the first thing I would do with an elderly patient starts limping and you suspect arthritis and there's no signs of, injury or anything acute having happened, but it's sort of a gradual onset, increasing stiffness or lameness. You can, of course, go for a full diagnosis and have X-rays. If you don't want to do that or don't want to do that yet, I would always start with supplements. That's the first thing I would do. I would so often even do it before symptoms. If someone either a giant breed dog or a dog that's had joint surgery or even just any dog, if it becomes old enough, I would start them on some supplements that improve or support um, joints, oils, glucosamines. There's a variety supplements, and there's lots of nice products that combine them, and UMove is one of them. I think that's a good product to start her on. I'm not sure whether she mentioned it, but I'm not sure whether she said it had been suggested or it had been started, but I think it would be a good point to start. The other thing I would do if she's already lame is I would probably see an osteopath or a chiropractor just to get someone to correct, someone to find out where is the issue, what is the issue. And it tends to be that whatever the issue, the original issue is, there will very, very quickly, happens to all of us, if we're sore in one place, we start compensating and then we become stiff and sore and overexert other joints. So it's just a really good idea to see an osteopath or a chiropractor. And I have a feeling that Jane and Puppy are in London, and there are loads of good animal osteopaths around. So that would be the second thing I would do on top of supplements. And the third thing, if I'm right and they're in London, is that there is a couple of acupuncturists, Alistair and Claire Greenway, have Greenway Acupuncture, and they operate in and around London, and they do a home visit acupuncture service, which can be a great help for someone who just needs ongoing support with their musculoskeletal system. So I would probably do all those things before trying painkillers. I would do the supplements, I would do the osteopath, I would try acupuncture, and see if one of those or those in combination make her stop being lame. And if not, then I find in terms of painkillers, what I would not do, referring back to previous chats we've had together, is to go straight for Librela injections or something like that. I would have, if you've done the supplement, you've seen the osteopath, you've tried acupuncture, and she's still lame, then I would probably suggest that you do a trial with a painkiller. Talk to your vet, whatever they want to give, Previcox, Ontior, whatever they feel is suitable, and just give her painkillers for 7 days, 10 days, and see how big of a difference does it make. Because it's difficult. We can't ask a dog if it hurts. Sometimes lameness is pain. Sometimes lameness is just stiffness. You should see me in the morning, but it doesn't hurt anywhere. I'm just not as smooth and agile as I once was. But if you give painkillers for a week or for 10 days and you can't really tell a difference, then I would feel that it was fair to conclude that there isn't a lot of pain going on. But sometimes when we do that, it can be quite heartbreaking, because an animal can suddenly start behaving in a way they haven't done in years, and you suddenly realize, oh no, you've actually been in pain for a long time and we never realized. So that would be my approach, I think, to an older dog that starts being lame or stiff. That was a long answer. What have I not said? What can we add to that?
I mean, I think there's definitely things we can add to that. So I totally agree with you about supplements being the first thing to do. And I actually often recommend to people something that I did with one of my dogs. So my collie bitch has always been super active. So at home, she's like quiet and cuddly. And then on a walk, she's just like zoom, 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 zoom. And so when she turned 8, I just started her on joint supplements because I was like, the wear and tear on these joints from the way she runs, it's going to be higher than your average dog. So I would rather, before I see even the slightest hint of anything, do something to support the joints. So that's what I've done. And I often recommend that in my really active patients as well. Otherwise, I take a very similar approach to you. But the thing I'm surprised you didn't mention is obviously homeopathy.
Oh, no, of course.
I mean, homeopathy can be amazing, especially for like stiffness getting up things. Like, there's a lot of classic remedies that are really great for arthritic stiffness. And that can be the stiffness that isn't that uncomfortable, but where they just look quite awkward and uncomfortable, but aren't necessarily in pain. And, I've had some animals be just on joint supplements and homeopathy for ages after an arthritic diagnosis. Because sometimes what I think you often see in these arthritic cases is they might have been slowly brewing up to something over time, but then they'll have like an acute incident that the owner doesn't always see, and they suddenly go really lame. And in those cases, if the dog's really uncomfortable, I'm not against them having like a few days to a week of anti-inflammatories if it's suddenly come on really acute, because that can just give you a bit of time to then work on your natural options, maybe book an acupuncture session, you know, get hold of the supplements and get them getting into the system and all of that kind of thing. But obviously it depends on pain levels. If it's very mild, less worrying. If they've suddenly gone really lame, then I think that can be a nice way to start off, so that you're not, you know, starting on the back foot where you've got masses of inflammation and pain. The other thing I use loads in arthritis is herbs. So there's loads of great herbal anti-inflammatories. You can get them either in tablet form. There's often powders you can get, or you can see a herbalist and get like an individualized liquid blend made up for your dog. The great thing about seeing a herbalist in a geriatric dog is that obviously there's loads of things that can go wrong in geriatric dogs. So if you have an individualized herb mix, it can cover the arthritis and the inflammation and pain side, but you can also support your liver and kidneys, you can support the circulation, you can support the brain, and have it as a kind of geriatric mix rather than just going, let's just treat the arthritis. You can kind of support aging in a really nice way. I really like creating those mixes because I feel like it can just make their older years so much more pleasant for them and for you, because it's less worrying. But otherwise, I totally agree with everything you said. I think the chiropractor or the osteopath, I think the acupuncture. The other thing to bear in mind is if you've got like muscle wastage, to think about hydrotherapy, because also that can really help. Because with my bitch anyway, she doesn't really show pain very easily. So by the time I realized she had some arthritis, because she's 11 now, she had a little bit of discrepancy in the muscling on her hind limbs, which I hadn't noticed because she's a fluffy collie. It's not an obvious thing. So we've been doing hydrotherapy and we've carried that on even though she's back to equal muscling. But I think that can also actually help to loosen them up quite well. Yeah.
Absolutely. Yeah, I'd say pretty much similar. A lot of things have been said. It was one thing I wanted to ask my homeopathic friends, though. A lot of my friends in the US now are starting to use homeopathy, and they use a combined combined remedy called tea relief. I don't know. I think I asked maybe Lisa once before, but have you heard about this, Vicky?
I've never heard of tea relief.
Okay, it was like
It might be tromeal or something like that.
I wondered
Possibly.
about that.
It was a mix of a few of them, I think, with arnica and some other things in it.
Yeah. There's a product, quite a popular product in Europe called tromeal, which is an arnica combo with sort of injury, muscle, joint supportive remedies. Classical homeopaths generally frown a little bit about mixed remedies. It's not the optimal way to go, but if you're dealing with acute injuries or, you know, first aid kind of situations, it can be good, and it has the big advantage that it's easy. So it's easy to prescribe, and you don't need to wait and spend a lot of time choosing what to give.
But I think those remedies are great for owners to have at home, because you also have things like RRA, which is the root of rust toxin arnica, which is like a classic kind of trauma mix. But also some of the different homeopathic pharmacies have their own like injury mix or other things like that, which owners will often have at home. So it's an easy thing for them to do whilst they're waiting to see the vet or see their holistic vet or whatever. It's just something that you can do from home as soon as you notice lameness in your dog.
Yeah. And arnica is often a main part of it. I tend to I mean, my clients tend to just have arnica, and then if anybody hurts themselves, they'll give them arnica. But you can also give these things that are arnica with a few other things, for sure. Can I just add to what Vicky said, that I think it's a really, really important point, that it's never a choice between holistic treatments and, say, painkillers or anti-inflammatories. If you have someone in pain, I mean, number one priority always is that the animal mustn't be in pain. So I think it's always okay to give painkillers. It's just if you go straight to ongoing, you know, I mean, drugs, then you skip a lot of steps, in my opinion, and you're more likely to run into side effects. In my book, when I list the arthritic treatments, I do it as a kind of ladder that starts with supplements, and then come, I think, all the other things we've mentioned, and then at the very end of that are painkillers that I would generally start using on an as needed basis, and then only, you know, make it a permanent thing at the very end stage when nothing else is enough to keep the patient pain free. But keeping the patient pain free goes without saying. I mean, that's always whatever it takes to keep the patient pain free.
I wish more vets had this mentality as well, because I've worked in a lot of different practices now, and I always see they come in and the first thing they are offered is Librela, and
Yeah.
Always.
it's all
Yeah.
of the steps, and there's sometimes even really young dogs or something with the like sometimes ducks with a herniated disc or something. It usually goes away, and then they're on Librela for the rest of their lives, and it's yeah, it's a lot of steps before that. Um,
Yeah.
so yeah, I usually start obviously just focusing on the arthritis part. Look at the whole dog, you know, treat what else is there. You have to custom it to the individual pet. I look a lot into the diet. You know, are they getting optimal diet? This one was getting homemade diet, but I always look into that. I love to add like fresh things with antioxidants. Make sure that the omega-3 levels are good. Definitely supplements. Thinking about things like Boswellia and stuff as well, and the typical joint supplements that has chondroitins and those kind of things. The only thing I would
Mm.
say about supplements is I used to be very picky about my supplements, and I honestly think it's really hard to find good supplements that doesn't contain a lot of crap. Because a lot of them contains like a lot of starches or inflammatory ingredients or potentially carcinogenic ingredients or ingredients that interfere with the other ingredients. So there's yeah, I think it's a rabbit hole to try to find the right product sometimes, because yes, you get something good out of it, but then you also get something bad out of it, and then I feel like it kind of evens out. So I always advocate for trying to find the best possible
Mm.
supplements near you. And then I always look a lot into the lifestyle of the animal. So, you know, at home, for example, do you have carpets on the floor? Are they slipping a lot? Just as small slips can be enough for an old dog to get a flare. You know, pain is not always linear. It can be, for a lot of dogs, it's like maybe they're stiff in the morning, or maybe some days are worse than others. You know, it's not always the same. So if we can try to like avoid the big flare-ups as much as possible, we've already gotten like really far. And like she mentioned, like she noticed it more at some surfaces than others, especially if it doesn't sleep in his bed. So a good orthopedic bed is super important. Having some nice surfaces, and for old dogs, it's very nice to walk often, and not just like once a day, but a really long, hard walk, but just keeping it flowing, like moving a little bit all day. I actually have a downloadable free PDF on my website as well about this, where I wrote everything down. It's usually my typical handout in the clinic life as well, because in a Western practice, I don't really have time to go through everything. So I just give this to the owner. And as Lisa mentioned, you know, at some points we do maybe have to go to drugs, but there are other options as well. I sometimes do cartrophin. I don't know if you guys use that a lot in practice.
When I was
Uh,
in practice, we used it quite a lot, but I tend not
Mm.
to now.
why is that?
I mean, I think just because I don't really do any other injections, so it just doesn't occur to me as something to be
But
doing.
you've also got so many other tools. But I think for a
Sure.
conventional vet, it's a nice first step. It's a nice thing to do before you
Mhm.
reach for the drugs or the, yeah,
Yeah.
absolutely.
Which is
Yeah.
a little bit, well, they say it has less side effects, and I've seen some good results with it as well. So there honestly, there's so many ways you can go about this. There are people doing, you know, joint injections and those kind of things. I definitely recommend acupuncture, because for arthritis, I
Mm.
think that's like the one thing I treat with acupuncture is arthritis and joint pain, because it works so well. So if you have the possibility, if you have people around that can help you with this, if you have a qualified acupuncturist, definitely something I recommend to try for an animal that is open to well,
Mm.
needles, or you know, I think it's okay to go to the vet. We don't want it to be a very terrible experience. But yeah, definitely one thing to keep in mind. If I can advertise a little bit more, I do also have an ebook on my website about acupressure, so you can do things at home as well if you're not able to get to an acupuncturist, or if you want to do more in between or similar. And then, yeah, when it comes to the actual drugs as well, I prefer to go to Galliprant or Gapiprant instead of a lot of the other NSAIDs, because they tend to be milder on the gastrointestinal symptoms, and is well, might be a safer long-term drug if you need to use it for a longer period of times. And then I like to add an extra drug, say for a bad day, like one of those maybe paracetamol codeine mixes, something like that, for like a flare-up, like when they're having a really bad day. And yeah, that's kind of the way I go about it. I start with all the mild things first, and then, like Lisa mentioned, if you have, you know, physio, chiropractic, osteopathy, it depends very much on the patient as well. But there's so many things we could do to make it better before we
Yeah,
just
and that's really the main message, isn't it? There are so many things that can be done. And what which step or which thing to do or which combination of things will make the difference in each case is what you need to the vet for. You know, that's what it's not the same for everyone at all, but there are so many things you can do. I had a dog recently that had been treated for quite severe arthritis for years, and it was not responding to any of the painkillers anymore. It had been on steroids for a while because that was the only thing that would relieve the pain, and they just wasn't covering it anymore. And they did x-rays and they said, no, this is the sight of these hips, this dog is beyond, we need to euthanize. And she had, and I've never seen anything. I mean, I have seen something like it, but in arthritis this severe, we gave her a good homeopathic remedy and she was pain-free immediately, and she just ran around, and she has not needed painkillers since. It was quite astounding. That's not always how it happens, maybe because I don't always find the right remedy just like that, and that was certainly a situation where I wasn't even prepared to say, let's give this, let's work with this dog was suffering and they couldn't stop the pain, but she had the remedy and it suited her, and literally within days she was just running around bringing toys. Amazing. So yeah, no, absolutely, homeopathy can also be the one that makes the difference.
And if I
But I
can add,
also think, just saying that, it's really important to bear in mind that you can't judge every pet by the x-rays.
I was just
No.
going to say that.
Yeah, sometimes x-rays look really bad, but the dog is not that bad.
Yeah.
Or the dog is really bad and the x-rays are not that bad. And so, you can never like assume a prognosis based solely on what you're seeing on x-rays. So if your vet has shown you x-rays and they're like, this looks awful, it's like the worst arthritis I've seen in years, that does not mean that you can't manage it. You just have to try and see what happens, because you may find it responds immediately to the first thing you do and everything's fine again.
Sure.
Or you may find that it's more challenging. So yeah, judge the dog in front of you and not what the x-rays are showing.
I just had this conversation today, and that goes for blood tests as well.
Yeah.
It may be that the blood test is showing a deterioration, but the dog is clinically so much better, and that's what matters. Absolutely, yeah.
Another thing I wanted to say based on this conversation is, I don't know, like I seem to have this thing from what I've noticed, is that dogs that are fed a raw diet, I find if you start them on a glucosamine chondroitin mostly based joint supplement, I don't really notice that big a difference. But if I start them on a more green lip muscle heavy joint supplement, I see much more of an improvement. And I mean, I have theorized from seeing this that it's because there's so much glucosamine and chondroitin naturally in a raw diet, because you're feeding all those structures. Is this something that you guys see as well?
Yeah, no, absolutely. And I've thought that as well, that presumably that works if there's a lack. You're giving them the building stones to repair their cartilage and their joints. But if they're already fully supplied, it's not going to presumably make a difference. So yeah, no, I agree with that completely.
Absolutely. And one more thing I forgot to mention that I have started using quite a lot recently is low dose ketamine injections. I quite like them and find them they work pretty well, which is a little bit milder in side effects than a lot of other drugs. So, just want to add that on there.
I've had a few patients on those recently as well, including my parents' dog, and yeah, I think they seem to work really well. I was pretty dubious about it at first, but actually, yeah, it seems to be pretty good.
Apparently they use it a lot for humans as well, even for humans with I think like anxiety and some mental disorders as well, with quite great success. So
Yeah, interesting.
yeah.
I think definitely like the key point is just not to go straight for NSAIDs, because it's just, you then enter that like cascade of intervention thing where the NSAIDs are then causing a gut problem, so then your dog's put on omeprazole, and then as well, as soon as you've started on those drugs, you're like, I always want pets to be on as little as possible, because then you've got somewhere to go. If you go in at the top of the stairs, you can't keep climbing after that. If you've gone in at Librella, you're on the top step. Like that should be the last thing that's going in. What are you going to add in on top of that? And then you start getting all of these like serious drugs, like gabapentin and like things that do have quite nasty side effects. And whereas if you can start with all of these things that we've talked about, you've got like so much time ahead before you've entered that cascade of intervention, and you're not getting into those big nasty drugs for hopefully much longer.
And that's the main message, isn't it? There are so many things that can be done. I would say it's not necessarily a situation that I would expect to be able to handle from home. You know, you need to go and see a holistic vet, and you need to find out, and you definitely need osteopaths, presumably, probably an acupuncturist in there somewhere as well. But there are so many things that can help. Yeah, definitely.
Did you have some more questions, Lise?
Yes, there was. I can't remember the name, but someone was asking, someone were writing to me that they had a cat, and they have an adult cat, um, and they're waiting to pick up a kitten, and the the breeder wanted to keep the kitten until the kitten was 13 weeks old. And so they've been waiting, I think, a few weeks to pick up this kitten. And then they have become aware that the breeder doesn't vaccinate. And the breeder's cats are not vaccinated and the kitten is not vaccinated. So now this person was getting very anxious about whether it was safe, excuse me, to pick up an unvaccinated kitten and bring this kitten into their home. And my answer was that I wouldn't really worry. I would never pick up an animal that had any symptoms. You know, if you go to pick up the kitten and it's got runny eyes or runny nose, or it's sneezing, or doesn't have a good weight, or just doesn't look healthy, then I would turn around. If any of the other cats in the house were sneezing or looking unwell, I would also be on guard and probably not take the kitten. But I would never take home a kitten that wasn't healthy, but I wouldn't worry about taking a kitten that was unvaccinated at all. But I'm not sure. Yeah, I don't. What would you say?
So are her other cats vaccinated?
Yes. Yes.
So, I mean, my question would be, you know, if you believe in vaccination and your cats are vaccinated, what would be the problem in bringing in an unvaccinated kitten? Surely
Yes.
the main concern would be whether the unvaccinated kitten would have a problem. But then, obviously, as soon as she gets it, she's planning on taking it to the vet to be vaccinated. And timing wise, that's probably a much better and safer time to be vaccinating your kitten than it would be if you'd got it at 8 weeks old, when it probably still had maternal antibodies and everything like that. So actually, I feel like she's getting the best end of the deal. If she's wanting to vaccinate, she's getting it at a much more appropriate time for vaccinating without having to worry about keeping it at home unvaccinated. That bit's already been managed by somebody else. She's getting it. She can take it to the vet and get it vaccinated. There shouldn't be a worry to her animals because they're already vaccinated. All good.
Yeah,
I'm so happy you said that, because that's exactly how I feel. Totally. And if the kitten, I think the fear was that there was something latent in this kitten that they might not pick up on, that would then, you know, run rampant in all the cats when they brought it home. But I mean, if a kitten had, it's not going to have panleukopenia, it's going to be dead or dying if it had panleukopenia. The only other thing that it could conceivably have would be cat flu, and there would be symptoms. So
But I mean, even a chronic cat flu carrier, like that could be a vaccinated kitten. It could have had cat flu before it was
yeah.
vaccinated. It could still be a cat flu carrier. So to me, it doesn't make a huge amount of difference if you're
No.
bringing home a vaccinated or an unvaccinated kitten. The risk with flu is the same. And like you say, if it had panleukopenia, it just would not be coming home with you.
No. And also there is this whole issue that I find the timing of the puppy vaccines or the kitten vaccines is often quite unfortunate, because there is always a period of immunosuppression immediately following a vaccine. And it's just unfortunate if you have them vaccinated and then a couple of days later they have to change their entire environment, and, you know, their whole life has turned around. It's not necessarily the best time for a vaccine. I would much rather receive an unvaccinated kitten, keep it indoors. I will probably even have it for a week or two, let it settle, and then take it to the vet for a vaccine. So yeah.
absolutely agree. And I just want to mention, in Norway, it's actually quite common not to vaccinate the cat before they sell them. I don't know if in the UK or Denmark that's different, but
It's generally done. It's funny you should mention that, because I just spoke to someone today who was picking up a puppy in Finland, who said that they never vaccinate them at 8 weeks. They just never. They sell them unvaccinated. And I thought, I never heard that before. I don't know any Finnish vets, but maybe that's you know, along those lines, that to wait.
yeah,
I
I
don't think
feel
that's
like I think that's way better.
Mm,
Like, I'd much rather pick up an unvaccinated animal, because I have lots of clients that call me and they say, I've just got this puppy. I was planning to do a later vaccination, but it's already had a vaccine at 8 weeks. What do I do now? And then they kind of feel pressured to do the 12-week one, which means that then they kind of feel like if you're actually going to be doing it properly, you should be doing a 16-week one, but then it's had 3 vaccines. So actually, I feel like it would be better if they were just selling the animals unvaccinated.
Yeah.
And most of the time, if they don't get it at home, obviously you can ask the parents, like, have you tested or have they had symptoms of like herpes or something like that, or anything that can go horizontal transmission. But otherwise, oh, I forget what I was going to say.
It'll come back to you. It'll come back to you in a second. But no, I agree. I mean, I've years ago, I've had my old dog had 2 litters, and I sold them both unvaccinated, and it was quite a big deal. But I had a kind of proper sit down with the owners, and I wrote a little note that they could take to their vets, and you know, when I stayed in touch with them, they all said, oh, the vets thought that was really exciting and really cool, and you know, it's about the information level, because it can sound like neglect. You know, they haven't vaccinated them, but actually when you realize that this is based on proper consideration, and you know, there are reasons behind this. I absolutely agree. I'd rather have an unvaccinated one. And also, I feel when we talk about vaccines, we shouldn't really just be saying vaccines. You know, we need to know what vaccines are we talking about, and what diseases are we actually very worried about. And if the kitten looks healthy, I wouldn't worry at all.
And a lot of times they pick up a lot of these diseases outside, and most of the cats are not out yet, you know, for probably a long time until they're castrated. So, you know, the risk of picking up something is quite low. You know, there's always a small risk of bringing in something with your shoes, but like, depends where you live.
Yeah. So we agree that it's not an issue, and it's probably just a stroke of luck, really, to get a breeder that hasn't vaccinated. It's a good start in life for this kitten.
Yeah.
But I mean, on a similar thread, like I've had a couple of inquiries this week in slightly different scenarios about almost like the opposite thing. So a client who has had a litter of puppies, and she wants to save vaccinating her puppy until it's 14 to 16 weeks, but she wants to still have socialization with some of the other puppies from the litter who are perhaps being vaccinated earlier. And she was worried about the other puppies shedding and her puppy being exposed. And then another lady who, one of her dogs, so her dog was vaccinated at 12 weeks, and she came for a teacher test with me. I think the dog's now 3. And it had a total 0 on hepatitis. So I would assume in such a young dog that would mean that vaccine hadn't originally worked. So I recommended that she have a booster. But she's now worried because her dog that she didn't bring in for the teacher test, because he's really anxious, she doesn't know his vaccine or immunity status, and she's worried about the shedding within her household for the other dog. And I mean, I don't know what your thoughts on those scenarios are, Lise.
Well, I'm interested to hear yours. I have heard this discussed, but I have never seen it happen. I cannot say that I have ever seen a newly vaccinated puppy infect anybody, just ever. I mean, I've just not seen it as an issue. So my feeling is that it seems like a theoretical issue. I've just never come across it ever. So I don't worry about it at all. What would you say? What did you say to
I mean, for the puppy scenario, I said that like I wouldn't be too worried about that. You're going for a short period of time. The chance of them picking anything up is really low. They're going to have a really low level exposure. Even if the puppy is shedding, it's going to be such a small amount, and they're literally having a play date. They're not like living together in a house and potentially like licking and smelling each other's poos, and you know, having that kind of like inter-household things that puppies might do. And I remember chatting with Nick Thompson about this in the past, and he always had the view that kind of low level shedding is actually such a low exposure, it's going to help build the puppy's natural immunity. You know, there are a lot of holistic vets that talk about if you've got an unvaccinated dog doing, you know, small amounts of low level exposure to try and build natural immunity. And I would kind of consider that as being a way of doing that, having some odd play dates with them. In the household, it's trickier because I don't know this other dog's vaccine status. And I said to her, obviously the best scenario would have been if you had him teeter tested as well, because then it may be that there's no concern there at all. But how much do those 2 dogs interact? Do they groom each other? Is he at all interested in her poo? Do they pick up the poo straight away? you know, I don't think there's enough data on the shedding of stuff in the
I
poo.
just wouldn't worry at all, even in that. I mean, I've just had that actually, because I've got a client who has Dalmatians, and we know that one of them is a vaccine non-responder. When she was teeter tested years ago, she was negative twice, and then she was vaccinated, and then teeter tested again immediately, and she remained negative. So she's a vaccine non-responder. And a year ago, this owner got a puppy that was vaccinated, and so it comes up, and I mean, it was fine, but my advice was, when I've never ever seen it be a problem, I can't worry about it.
Yeah.
And it happens quite regularly that people, maybe someone who's read my books, or someone who just, you know, follows whoever and are aware of engineering the whole vaccine schedules the way that they want it to be done. So they ask the breeder not to vaccinate their particular puppy when the rest of the litter is vaccinated. Yeah. I've seen that thousands of times. I've never seen it be a problem. I've never seen all the vaccinated puppies who live closely together with the unvaccinated puppy. I mean, no, not once has anyone become ill from living closely together with their siblings for days before they're picked up. So I really don't think it's an issue. And also, it's not like they're together with someone who's got parvo. You know, it's a very attenuated, it's an injectable vaccine. It's not a dog that's sick with parvo. I mean, that would be a very worrying scenario to me.
I feel like it must be such a low level that they shed post-vaccine that I just don't see how it could create.
I think it's purely a theoretical thing. I really do. But yeah, it's an interesting one.
So it depends a little bit as well, I guess, what type of vaccine it is, because like most of the DHPs, for example, are modified live, which I think is very unlikely to. I haven't read anyone, I've never seen it anywhere that anyone else has gotten.
No, exactly.
And I think with the kennel cough, for example, the intranasal.
Oh no, yeah.
That's very different, yeah.
Yeah, I see that all the time. You take someone for a kennel cough vaccine and they get kennel cough from the vaccine. I mean, it just takes one drop or you know, I mean, that happens all the time. Yeah.
And
that's different.
In Sussex, when I used to work at Mark's practice, I know that there was a couple of kennels around there that if your dog had recently been kennel cough vaccinated, they wouldn't accept it until like a certain period after, to make sure that they didn't introduce kennel cough to their kennels.
Yeah.
Because that would be much worse than having a non-kennel cough vaccinated dog in, would be to have a really recently kennel cough vaccinated dog in that then spreads it to everybody.
Yeah. I mean, it's the silliest thing, the kennel cough vaccine. Sorry, Tina.
Yeah, some kennels even say like they want you to take the vaccine at least like 6 weeks before they come into the kennel. So I had an owner coming back to me being really mad because it wasn't given at the right time, because that one kennel wanted it to be given, you know, this early in advance. So of course this is okay. So anyone listening to this, if you are going to a kennel and you do need a vaccine, please check with your local kennel, because it's quite different how strict they are with the regulations and such, and it's kind of your role to figure that out and not ours. So yeah, be sure when you come in, you know, you tell your vet, I'm going there in this long. They say I need this vaccine this long before I go. So
or just to be safe, get it done like 8 weeks before.
Yes.
Or just don't. Yeah, sure. I mean, I think the kennel cough vaccine is a bit silly through and through, and I wouldn't do it at all. But if the kennel wants it, then it's really poor timing to have a kennel cough vaccine just before going into a kennel. I mean, that is unfortunate. But I mean, yeah. But no, I mean, it's good that you brought that up, because what we were discussing was the core vaccines. Parvo, distemper, hepatitis. I don't worry about shedding at all, because it doesn't seem to happen in real life. I think it's a theoretical thing.
I mean, with lepto, one of the things I know I've heard people discuss is whether there's a possibility that the increased number of lepto cases in this country has been linked with an increased number of dogs being vaccinated, and lepto is shed in dog urine. And have we actually been contaminating our country with lepto through dog urine? But I don't know enough about how the lepto vaccine is made, because it's not a virus, so it's not modified live.
No, it's a killed vaccine, isn't it? But I don't know. Yeah. I don't know.
I've just heard it as a discussion and I just thought it was interesting, but I haven't looked into it, or I don't know anything more about it. But
yeah, and talking about this shedding from vaccines and all, I just wanted to mention, you know, during COVID, a lot of people got really strict, especially in the holistic environment. A lot of people got really strict about spike proteins. I don't know if you guys heard about it. yeah, I've been denied access to certain places because of a vaccine as well.
Because you've had the vaccine.
Yes, I had to, otherwise I wouldn't be able to go to America and do my job and all that stuff. So it was unfortunate, but yeah, there was but yeah, some people are concerned about spike proteins from certain vaccines. I don't remember if it was the mRNA vaccines, I think. They're mostly concerned about it, but yeah, I don't know. I haven't read enough research that, supports it, so I don't know.
I had some clients that were sure that after they or someone in their life had the vaccine, that it actually affected their pet's health as well. I mean, I don't know anymore, but that's just the clients were really sure that that was like the trigger incident because they weren't really, nothing else was really happening at the time.
Well, there was this study on pet microbiome, wasn't it? That like when humans got COVID, it affected the dog's gut microbiome as well. There was a huge shift in the type of bacteria found in their gut to a less favorable bacteria flora. So maybe that could have something to do with this as well.
Well, it makes sense because I read this study that said like when you move into a new home, it takes something like 3 days for you to populate your home with your family's microbiome. So if it only takes 3 days to like populate your house with it, then like obviously your pets are part of your household, and so you're gonna really quickly any disruption to your microbiome. And I mean, it could have not been the vaccine; it could have been the excessive use of like hand gel and stuff like that, which every single time affects your gut microbiome.
So the point being, I suppose, that when we talk about vaccines, we should be specific. I mean, because I get that a lot, vaccines are bad or vaccines are good or when should I vaccinate? And it's definitely a good question, but we also need to look at, well, what vaccines are we talking about? Which one should we not give at all? Which one should we maybe give later? We need to be more specific than just talk about vaccines because it's not one thing.
Yeah.
Yeah, there was some questions in the chat actually, if there's any more information about the potential shedding of lepto.
Yeah, I mean, I'd have to look into that. I don't know enough about it. I think I remember from ages ago reading a study about vaccinated dogs and shedding of lepto-organisms that had been tracked, but I that's all I can remember about it.
It's all right.
I had lots of comments during the week about the talk that we had last week about phantom pregnancies that I think resonated with a lot of people, or a lot of, listeners had entire bitches and were concerned about phantom pregnancies. And the questions are very typically, but should we not give raspberry leaf, or when should we start raspberry leaf, or should we not give Agnus cactus, or when should we start giving Agnus cactus? And my only comment, we said that last time, but just to repeat it because I've had the question at least a handful of times in the last week, is I wouldn't give anything automatically for phantom pregnancies. A phantom pregnancy is a natural part of the female cycle. So I would only do anything at all if it seemed to be a problem. If the dog was literally unwell. Some dogs get diarrhea or whatever. I mean, lots of things can happen when hormones are cycling in humans and in animals. But I think in my experience, more than 90% of the cases where people are worried about phantom pregnancies and what to do about it, all they really need is to understand what it is and that it's a natural part, and that's why she's a bit different. That's because she's under the influence of progesterone, so she feels a bit different. And she'll be back in a couple of weeks and everything will be back to normal. And just, compare it to the female cycle, where you may not feel the same every day, depending on where you are and, what hormones are predominant. So I wouldn't do anything unless there was a problem, was my point about phantom pregnancies.
What's your thoughts on this, Vicky, about Agnus castus?
Yeah, I mean, I mostly agree. If the phantom pregnancy doesn't bother the bitch at all, then I tend not to do anything hugely about it. If the owners are really worried, I might look and see if we can do some individualized homeopathy, because I don't think you need to necessarily have a specific problem to try and find a dog's constitutional remedy. I think it can just more balanced anyway.
Yeah.
So if owners are keen, that's usually what I do. If the phantom pregnancy bothers the bitch in any way, they get loads of milk, or they get really anxious or clingy, or
Or aggressive. Sometimes they can become quite
Or
aggressive all of
irritable.
a
Yeah,
sudden.
that was the other
Yeah.
thing I was
Yeah.
going to say.
Yeah.
If any of those things are happening, or because, you know, if they get a lot of milk, it can then be increased risk of mastitis. And some bitches have really horrible phantom pregnancies. And then obviously you do need to do something because it's causing upset to your pet. But if it isn't, then I tend not to be overly worried about it. But the thing I always say to people is if your bitch is having phantom pregnancies all the time, then the risk that you have is that obviously hormone levels are higher in the system for a slightly longer period of time. So you could argue that there could be a slightly higher risk of pyometra.
I actually spoke to I can't remember his name, but he was president of the European, the diplomat holders and reproduction. And I asked about this, and he said that studies have been made to show that there is no correlation at all between false pregnancies and risk of pyometra. His words were that the only thing the two conditions have together is that the bitch has a womb. And ovaries, of course. I mean, they both occur in entire bitches. That's the only correlation. I thought that was really interesting.
That's really interesting.
Yeah,
So
yeah.
good to know, and to be
Because it's
able
one of
to
those
say,
things that you hear, isn't it?
yeah, absolutely. And I mean, it kind of made sense to me, and so it's nice to hear that actually that they've proved that. But it would make sense that they would prove that in Europe, because up until recently, the majority of our dogs in this country are just neutered, automatically neutered. So we just wouldn't have that data available that they would have in Europe.
If I can just throw on the functional medicine aspect of it, I just think, sometimes when they have pseudo pregnancy and it's a bit out of balance, like they have, symptoms attached to it, you can be a hormonal imbalance. And, pyometra as well usually comes from, something in the hormones, switches in the microbiome that can potentially lead to a pyometra. So I think sometimes you have a dog maybe with a hormonal problem, and in that sense it would make sense to me that they might be at higher risk of more issues down the line if they start, because I see this a lot, they start with some small hormonal changes, especially when I make my timeline and I look at everything. They start with some small things that are like changes in the hormones, but nothing are being done holistically or otherwise, and then down the line they start to get more issues. So I think if we can just attach it at an earlier point. I think that's the biggest thing I wish I could do. A lot of the patients we get is like it already has, cancer and allergies and crystals and all these things, and it's just like, wow, how do I fix this? I just wish they came at maybe my dog is out of hormonal balance. Maybe I should see a holistic vet, and we could attack it at that point, and we could potentially prevent such a havoc of symptoms down the line. So yeah, that's my biggest takeaway is if you're watching this, if you see something small, maybe your regular vet just brushes it off, says it's nothing, please go see someone, holistically minded, because usually there is something, and probably there's something we can do about it too before it actually becomes a problem, and your Western vet can help you with cutting out organs or similar.
Yeah. And that goes for everything, doesn't it? It goes for the dog that's being treated for cystitis for the second or third time, or you need to use eardrops for the second or third time, or something comes back, then there's obviously an issue that's not being addressed properly, and it's just going to get worse and worse unless it's addressed. The root of the problem is addressed.
And I mean, even
that's a very
before
good
that,
point.
I really like it when someone's like, I've just got a puppy and I want to talk about what I can do to make my puppy's life as healthy as possible. Because then, like, at that early stage, you can talk to your holistic vet about diet and different diet options. And, if they suggest a diet and it doesn't suit your dog, you've already started the conversation. So they can then go on very quickly, and maybe just an email communication, say, well, if you've tried this and that hasn't worked, then maybe the next step would be to try this. And you've already set up, they know about you and what you're looking for and your pet and everything like that. You can talk about minimal use of chemicals, which is going to help improve your pet's overall life. You can talk about vaccination. You can talk about all of these things that are going to mean that compared to a pet that didn't have those things, yours is going to be healthier. It doesn't mean they're not going to get a problem, because obviously you can't look at genetics and predispositions and everything like that, but at least you're starting from a better place. And then at that first point, you then go, right, this has changed. We need to chat again. Let's see what else we can tweak and what we can change. And yeah.
So exactly.
That is such a good message. Instead of just automatically doing what we've always done and then seek help when everything falls apart, that positive, looking at supporting health from the beginning, that's always a great way to go.
Yeah,
there's nothing more heartbreaking as a vet than, especially as a holistic vet, than seeing a pet come to you that if they had come to you like 2 months, 6 months, a year, 2 years before, you could have done so much to help them. But by the time they come to you, it's like end stage palliative care.
Mhm.
I've been emailing today with someone who contacted me, desperately wanted an urgent consultation, and I said I tried to refer her to other people. I've got a waiting list. I can't do it. And it was a 12-year-old dog with very severe pancreatitis that is on all sorts of medications for it, in pain, has been suffering with this issue since he was 2. So that's 10 years of pancreatitis and drugs and drugs and drugs and drugs. And now she's really desperate and wants, to be top of the cancellation list and really. And I did say to her, I think it's a bit late. I mean, I can't say that I couldn't help this dog. I'm not going to be able to offer him a consultation in time, and I'm not going to be responsible for him suffering for 2 months to wait to see me. But it is heartbreaking. Like you said, he could have been seen 10 years ago, and I'm absolutely sure he could have been fine. But yeah, it's
And
sad when it's at that stage that you become involved.
It's much easier to help like an inflamed organ, especially something like the pancreas. Like the pancreas, the issue with the pancreas is it produces digestive enzymes, and every time it does that, it digests some of its own cells. So if your pancreas has been suffering for a month or 2, loads you can do. You've still got loads of healthy pancreatic tissue. If you're 10 years in, I mean, how much pancreas have you even got left? And of that, how much of that is healthy? Probably none of it. So, you are limited in what you can do. And that's really sad, because we know there's so much we can do to help these pets. But if they're coming to you that late, and like you say, it's often suddenly really urgent.
Yeah.
And, we get booked up far in advance. We're dealing a lot with chronic disease. It's hard to fit acute stuff in. And we want to help everyone, but there is a limit. And the earlier you can come and see us, the more we're going to be able to do to help your pet live like a longer, healthier, happier life.
Exactly. I couldn't have said it better. It's one of I think the most frustrating things I do lately is like all the things that I get is already like years and years and years of doing, I'm sorry, everything wrong. Like doing all the, not necessarily, but so many things we could have done differently. Where I'm just thinking like maybe we wouldn't end up here if you just saw me a little bit earlier. So I just wish, it's honestly what we're doing is very different from typical Western, where it's like, see a problem, we fix the symptoms. It's very much like we're teaching them how to live a healthy life and how to prevent disease from happening in the first place, which is, I guess, very different from trying to patch up what you have in front of you, which is what Western medicine does very well, emergency medicine.
I mean, like, it's Western medicine is a disease care system. Like the same with the human medicine. It's disease care. It's not healthcare. That's what it's called. But healthcare is what you would talk to like a naturopath about, or a holistic vet, or a nutritionist. It's trying to create optimum health. And going to see a doctor, you are not going to get that information. Even if you go with heart disease, they are not going to give you loads of information on how to change your diet and lifestyle to help your heart. They're going to recommend heart drugs and heart scans and all of these other things, because they do disease care. They're not doing healthcare. And there's such a hugely vast difference between those two things that, yeah.
And then they will give you a prescription diet bag.
At least doctors don't do that for people. Can you imagine?
They do sometimes tell you, oh, sugar doesn't matter. Oh, eating ultra processed doesn't matter. And then they serve you ultra processed food at the hospital. So honestly, I don't know if it's that much better.
Oh, my
It's
friend
been in
just
the
had a baby
media a
and
lot around here. The whole thing about ultra processed foods has been in the media a lot, and that how detrimental it is to human health. And exactly how do you recognize an ultra processed product, and why you shouldn't eat it, and it's so interesting because all the time you're thinking, well, what is the most ultra processed product in the world? Is surely the kibble that we then, I mean, it can't go on. Vets or whoever sell these things can't keep doing it with a straight face while this public conversation is going on about the damaging effect of ultra processed foods. I mean, you can't hold both of those things in the same brain without you know, I mean, you just can't. It can't be headlines everywhere that ultra processed is bad, but your dog really should eat this product that, you know, is unrecognizable. You can store it at room temperature for years.
I mean, haven't Hills or Royal Canin, I can't remember which, just released like a lightly cooked food?
Royal Canin.
Yeah, which literally like goes against everything they've ever said, which I just find super hilarious. Why would you be releasing this if it wasn't something that was good and that you thought was going to be successful? Because people are realizing that ultra processed foods are not the way forwards, and so they're having to create something that caters to what people want and what is actually healthy for dogs. So it's going to be so interesting to see how firstly vets cover that conversation, like, oh, well, if you're suddenly recommending this, why did you
exactly that's what I mean. I mean, who's going to be able to keep a straight face for that? It's such a turnaround. It's bizarre that yeah.
One thing Royal Canin failed to realize is that a lot of these educated pet parents that are looking for fresh food for their pets are actually good at reading ingredients, and then they will see first ingredient, rice.
Yeah.
So yeah.
It's still a step forwards, and it has made me laugh a few times, just the whole concept.
I thought it was hilarious.
Absolutely. Oh, before we run out of time, there was one other question, which was about the use of Fragaria, which is a homeopathic remedy that is sometimes recommended to reduce tartar buildup. I've used it in my early days as a homeopath. It was one of the things that was quoted as being good for Fragaria, is good for teeth and good for tartar and good to maintain oral health. And I've given it to patients. I can't say I've seen great results from it. So I'd kind of forgot about it. I don't recommend it anymore. I would much rather recommend proper food, you know, bones and food, so that they use their teeth and they bite and tear and crunch and get proper blood flow and you know, to encourage that rather than a remedy against tartar. But I can't say that there might not be situations. I could imagine, I don't know, a toy dog, elderly toy breed with really bad mouth and maybe not up for a dental procedure. It probably better than doing nothing. But as a homeopath, I can't say that in homeopathy, it's very rarely a case of a remedy for a thing, unless we're talking very acute or first aid. And this is obviously not that. So I'm not really surprised that it doesn't seem to do great things for me, but it doesn't. What would you say, Vicky, as a homeopath?
Yeah, I mean, I totally agree. I've tried using it lots of times. I've had clients use it, and I've never really heard anyone say that it was revolutionary in any way.
I mean, no.
No. I'd much rather use like a good plaque supplement along with good chewing. And I usually find that combination, even if you've got quite bad plaque, can actually help to clear that over time. So, you know, one of the like seaweed-based plaque supplements, plus really good chews. So bones, if they're raw fed, getting the right bones that engage all of their mouth. I really like lamb necks and spines, or venison necks and spines, because you've got all those vertebrae for them to like use
for big dogs. For big dogs.
For small dogs, though, you know, you've got like turkey necks or things like that, where you can chop up and you can give them like a smaller chunk, and that's still going to engage more of their mouth. And then obviously, like otherwise good chews. If you don't want to feed bones, then just really good chewy things that can help rub off any plaque that slowly breaks down with your plaque supplement. I just think that's going to be more successful.
BPA free, BPA free, and nothing too hard like antlers, stuff like that. You know, you want to be able to make a little dent with your fingernail, otherwise too hard. We do see a lot of broken teeth as well, so no too hard shoes.
And we are out of time. Thank you, guys. It was lovely as always. Thank you, Vicky.
No worries.
And thank you, everybody out there. Send us your questions, like our page, and we'll be back next week. I'm going to disconnect.